My name is Emer Neville. I'm the Communications Officer of the Irish Second Level Students' Union. Today we're joined by the Deputy CMO, Dr. Ronan Glynn, to talk about the safe return to school and answer questions that students have asked us. Thank you so much today for joining us, Dr. Glynn. Why is it safe for schools to open when the rest of the country is in level 5 and cases are so high?
The schools were open from September to December, and they were opened and stayed open really successfully despite some really high incidence of disease in our communities over that period of time. And that was largely thanks to the work of teachers, but also, really importantly, thanks to the work of students in keeping themselves safe and doing all the things that we ask students to do and ask the rest of society to do, which is to obviously not go to school if you've got any symptoms that you're concerned about. And if you are going to school, to wear a mask, to keep your distance, wash your hands, do all the basic things that we've been talking about over the past year. The reason schools have been kept safe is because of the efforts of everyone involved in the school environment. And first and foremost, that's about students and students taking responsibility, as they have done throughout this pandemic.
Why is it safe for classes who come from different households to be mixing in the same class?
So we talk all the time about the fact that we don't want different households mixing. So I can understand then why the obvious question is, well, why can different households mix in a classroom? But the reason that we talk about not wanting mixing across society and in general across society is so that certain activities that are core priorities for us can happen. So of course we don't want every household in the country mixing when they want and particularly not at the moment. But we have to prioritise certain things like education, like healthcare. And as we've said throughout this pandemic, education has been a core priority for us. So the reality is that to allow education to happen, different households have to come together. What's really important though at the moment is that we don't exacerbate that by having other household mixing outside of school. So yes, come together with your classmates, do all the things that you're supposed to do during that time, keep your distance, wear a mask, wash your hands, don't go to school if you've got symptoms. But outside of school, try not to meet up with people from other households, because that's just really, really increasing the size of your bubble. And if someone within that bubble has symptoms, it obviously represents a risk to everybody within the bubble.
What are the protocols for close contact tracing in schools?
So since the schools reopened last September, there have been dedicated public health resources from the HSE put in place. So whenever there's a case or suspect a number of cases or an outbreak in schools, our public health teams immediately liaise with the school authorities and put in place all of the outbreak control measures that are necessary to stop the situation getting any worse than it needs to be. The precise protocols and what happens precisely in a given school or in a given class will depend on a risk assessment that's done by public health colleagues at the time. But in broad terms, I suppose it's a response from public health doctors on the ground making a risk assessment of the precise situation in a classroom or in a school and making recommendations based on that assessment.
Are the current regulations or protocols enough to keep students safe?
So we can't be it's clear that wherever people come together, there is a risk that we'll have cases and there's a risk that we'll have clusters, and we can't entirely remove that risk. But what we've seen from September to date is that in general schools have been what we would regard as a safe environment. That doesn't mean that there won't be cases or clusters, but it means that with all of the other protective measures in place, that teachers and schools, parents and students together, working together, have created an environment that by and large has been safe. And we need to continue with those measures from now to the end of the school year. And hopefully by the time people come back in September, we'll be in a much brighter place. And yes, we will still have to do some of the things that we're doing now, but hopefully the general the narrative and the constant talking about COVID will have gone away. That's certainly my hope, is that we'll be in a much brighter place come next September.
Why were the schools closed in the first place?
So schools were closed or didn't reopen after Christmas because we had a really, really extraordinary level of disease in the community. And given the levels of disease in the community at the time, we just couldn't afford to open up anything else across society It was nothing to do with what happens in schools themselves. It was our concern that 1 million students going back to school, the movement of their parents, the movement of their teachers, all of those different households coming together at a time when we were seeing levels of transmission that we'd not seen the whole way through 2020. We just felt we couldn't in good conscience advise that schools should reopen in that context. Thankfully, over the last 2 months, 10 weeks, we've seen a really steady, significant improvement in disease incidence across the country, thanks to the efforts of students, thanks to the efforts of parents, families, all across society. People have made huge efforts to get us to where we are today. We're still not where we want to be, and we need to keep improving. But we felt, based on the improvement that we'd seen over the last number of weeks, and again, based on a core priority that we have to get children back to school, back to the environments that they flourish in, we made a recommendation that schools could reopen from the beginning of March on a phased and cautious basis. But obviously, again, we have a new variant. We have to monitor it all the time, and we are monitoring it all the time.
How much of an issue is the new variant?
The new variant is an issue. It's more transmissible, and but what it means for you as an individual is simply that you need to work that little bit harder not to drop your guard, to wear your mask more often, make sure you're wearing it correctly, that it's tightly fitted, that you're washing your hands that little bit more often. Crucially, that you're not mixing with other households outside of school. Because we know that once there's a case, once this virus gets into a setting, it spreads more easily than it did in 2020. And for that reason, we need to avoid as much as possible giving it opportunities to get from one setting to another setting. So yes, it means that what we're doing is harder. But again, we've had more of this variant in this country than probably any other country in Europe outside of the UK since in 2021. And despite that, we've managed to see really significant progress. So yes, it's harder to overcome it, but we are overcoming it. And it's just important that people keep doing the things that they've been doing.
What can students do individually themselves to keep schools safe?
I'm afraid it's quite boring, because people will probably have heard me or others talking about this stuff many times over the past year, but it really hasn't changed. So the key thing is that if you have any symptoms of COVID, so if you have a cough, a fever, shortness of breath, or if your sense of taste or smell changes at all, or if you have any concern that you have flu-like symptoms, you should not go to school. You should stay at home, isolate, and make contact with your GP, and they'll organise a test. And it doesn't matter if that's during the week or at the weekend. Whenever it happens, call your GP and they'll organise a test if it's appropriate for you. That's the most important thing. The second thing is to try and avoid mixing with other households outside of school. You're already meeting with lots of different households in school, and we need to keep those bubbles as small as we possibly can over the next while, given that we still have high levels of disease in the community. Then beyond that, it is the boring things. It's wearing your mask correctly, make sure it's tightly fitted, washing your hands regularly, and just in general doing all the things that I know students have been doing throughout the past year. And we know that you've been doing it. We know the vast majority of people have been doing this, because otherwise we would have seen much higher levels of disease in your age groups, and we haven't seen that. So I always talk about the silent majority. And yes, it's always very visible when someone isn't doing what they should be doing. But remember that the vast majority of people are quietly doing the things they should be doing. And that's really what's contributing and helping us to control this disease.
Thank you so much today for joining us, Dr. Glynn. The questions and answers were put very well, and I hope they eased any concerns and queries that students have had across the country. Thank you so much for joining us, and goodbye.